With this vote, we're rejecting a system in which one class of people can afford to stay healthy while another cannot. It demands for the first time in American history that good health will not depend on great wealth. This is not about politics. It certainly is not about polling. It's about people. It's about life and death in America. It's about human suffering. And given the chance to relieve this suffering, we must. Citizens in each of our states have written to tell us they're broke because of our broken health care system. Some send letters with even worse news. News of grave illnesses, preventable death. For weeks, we've heard opponents complain about the number of pages in this bill. But I prefer to think of this bill in terms of the people it will help. A teenager named Caleb Woltz is a high school student from Sparks, Nevada. Like so many kids, he used to play soccer when he was younger. Now he just sticks to skiing and rock climbing. You can forgive him, I'm sure, for giving up soccer, Mr. President. You see, Caleb was born with legs that end above his knees. As children mature, even Caleb, they grow out of their clothes. Most kids grow out of their shoes. Caleb doesn't. A lot of kids probably get a new pair every year, but Caleb has needed a new pair of prosthetic legs every year since he was 5. Unfortunately, unbelievably, Caleb's insurance company has decided it knows better than his doctor and has decided Caleb doesn't need those legs. That's why this bill will make it illegal for insurance companies to use pre-existing conditions as an excuse to take our money but not give you coverage. This is a big change, but isn't it a good change? I'm voting yes because I believe Caleb deserves a set of prosthetics that fit. Ken Hansen wrote to me from Mesquite, Nevada, a town on the border of Nevada, Utah, and Arizona. He has chronic heart problems and parts of his feet have been amputated. But Ken can't go to the doctor because he makes too much to qualify for Medicaid and too little to afford private insurance. I share with the Senate exactly what Ken wrote me. I'm very frustrated because it seems my only hope is that I die very soon. I can't afford to stay alive. End of quote. That's why this bill will expand Medicaid to cover people like Ken from Mesquite, Nevada. We're caught in the middle. I'm voting yes because when someone tells me his only hope is to die, I think we have to take a close look at that. I can't look away. I cannot possibly do nothing. A man by the name of Mike Tracy lives in North Las Vegas, Nevada. His 26-year-old son has been an insulin-dependent diabetic since he was a baby. The insurance Mike's son gets through work won't cover his treatments, and the Tracys can't afford to buy more insurance on their own. But his family's troubles are more than just about money. Since they couldn't afford to treat their son's diabetes, it developed into a disease called Addison's disease, which of course they can't afford to treat either. This disease can be fatal. This is what Mike wrote me just 2 weeks ago. Again, I quote, "I don't know what to pray for first, that I will die before my son will, so I don't have to bear the burden, or that I outlive him, so I can provide support to his family when he's gone." End of quote. Quite a set of prayers, Mr. President. This shouldn't be a choice any American should have to make. Shouldn't be a choice any father or mother should have to make. And when given the chance to help people just like Mike, our choice should be very easy. That's what this legislation is all about. On average, an American dies from lack of health insurance every 10 minutes. That means in the short time I've been speaking, our broken system has claimed at least 2 lives. Another American has died. Another American has died. 2 have died. A preventable death, each of them. So as our citizens face heart-rending decisions every day, tonight every senator has a choice to make as well. That choice: are you going to do all you can to avert the next preventable death? Mr. President, I hope so. I urge an aye vote to stop this filibuster.
On this vote, the yeas are 60, the nays are 40. 3/5 of the senators duly chosen and sworn having voted in the affirmative, the motion is agreed to.